You have come so far in your pregnancy, but now every further day feels like an even bigger burden. And so all you want to know is, what is the fastest way to induce labor?
Right. So in this video, we are going to share with you the 5 fastest ways to induce labor according to scientists. Plus, we're also going to tell you how fast they can work.
Yes, and then we're also going to share with you the number 1 factor that determines if inducing yourself is going to be a success or not, and what you can do to increase your chances of success. Please listen to this, because this is really the key to everything related to labor induction.
Right.
Nathalie here is a pregnancy and birth consultant and TCM therapist.
And Matthias is a researcher and science geek, and what we do on this channel is helping expecting mummies naturally and science-based.
Yes, so what's the fastest way to induce labor? Okay, so please note that the tools for labor induction that we are going to discuss now are not ranked according to how fast they can work, because this is really different from woman to woman, right? All we can tell you is how fast they could work according to scientific studies. So one of the fastest ways to induce labor is obviously a medical induction.
Yes, actually, many people believe that a medical induction is always the fastest way to induce labor. But believe it or not, that's not necessarily the case. The reality is that successfully inducing labor at the hospital may take several days.
Yes, in fact, very often they may have to try different tools and medications, such as synthetic prostaglandins or oxytocin, depending on the status of your cervix, in the hopes that one of them leads to success, right? However, under normal circumstances, we expect labor to start within 24 to 48 hours after a medical induction.
Yeah.
But it very much depends on that one factor that we are going to share with you at the end of this video.
Right. The next potentially super fast way to induce labor is castor oil. Believe it or not, but the reason why castor oil can work so well is because it is a laxative. And what a laxative will do is it will cause a certain reaction in your intestines.
Yeah, I tried castor oil once just to see what it does, by the way. Let's just say our toilet became my best friend, right?
Oh my god. Anyway, so why is diarrhea supposed to help? Well, because your uterus, if you have one, right?
If you have one, yeah.
Sits right in front of your intestines. And so if the reaction in your intestines is strong enough, it can have a spillover effect on the uterus.
Yes, and this can be really fast. In fact, scientific studies found that castor oil often brings on contractions within 12 to 48 hours. But first of all, it does not work for everyone. Personally, I did not get any contractions either, right? But in general, it does tend to work better if this is not your first baby. Plus, the success rate of an induction with castor oil very much depends on that one factor that we are going to share with you at the end of this video.
Right. The next potentially fast way to induce labor is a membrane sweep. A membrane sweep is basically when during a cervical exam, your healthcare provider sweeps their finger across the membranes that connect the amniotic sac to the wall of your uterus. As you can imagine though, it requires a certain degree of dilation, as otherwise your provider would not be able to get through the amniotic sac in your uterus.
Yes, but basically what this process does is it causes the release of more labor hormones, which help prepare the cervix for labor and dilate it. It's often done in the hopes to avoid a medical induction, and it can work quite fast. Studies show that women often go into labor within 48 hours after a membrane sweep. But that too will depend on that one factor that we are going to discuss in just a minute.
Right. The next potentially fast way to induce labor is nipple stimulation. Nipple stimulation should not be underestimated because it helps the body release oxytocin, and this could help you bring on the kind of contractions which could send you into labor within 48 to 72 hours according to scientific studies.
Yes, studies have found though that nipple stimulation is more likely to work if your cervix is soft. Moreover, it seems that it is easier to bring on contractions if you had at least some contractions in the past already, right?
Right. And then the fifth super fast way to induce labor is when your provider breaks your water. In fact, normally you can expect to go into labor within 24 hours after your water broke, sometimes 48 hours. But then there are also cases when a woman does not go into labor after her water broke. And when that's the case, there is normally no way around a medical induction because your baby is no longer protected from infections.
Yes. Keep in mind though that breaking a water is something that should not be done routinely, right? In fact, we only really mention it because it can induce labor pretty fast if it works.
Yes,
right?
but whether or not this is an option depends on many factors, such as the position of your baby, for instance. Because let's say your baby is facing your front instead of your back, then it will be much more difficult for your baby to turn when they break your water. So that's just one of many factors that need to be considered.
Yes. Now, as already mentioned, labor induction, both natural and medical, will not always work, or at least not work immediately, right? And there is really one factor that determines whether your induction is going to be a success or not. And that's your body's readiness to go into labor, which is defined by two things: the status of your cervix and the position of your baby. So what does this mean, and how can you stack the odds to your favor?
Well, as you probably know, as you're getting closer to your due date, your cervix undergoes some changes. It will soften, it will move forward, it will thin out or efface, and eventually it will dilate. And the more progress your body has made in regards to those changes, the easier it will be to bring on contractions to help dilate your cervix. That's pretty obvious, right?
Yeah.
Because as long as your cervix is not soft, for instance, it cannot dilate.
Yes, and on top of that, the pressure of your baby's head on your cervix will also help you with the cervical changes. And so if your baby is engaged and thus applies constant pressure on your cervix, your body is more willing to go into labor. As a result, any attempt to induce labor is more likely to work, right? And this can be calculated, by the way, with the help of the Bishop score.
Yes, the Bishop score basically tells you how likely an induction is going to work, but it also tells you how likely it is that you go into labor spontaneously. And not surprisingly, it is calculated based on the 5 factors that we just mentioned. Softness of the cervix, position of the cervix, effacement, dilation, and the baby's station in your pelvis. If you want to calculate it yourself, then bear with us. We are going to tell you how in just a second.
Yes, so the question now is there anything that you can do to increase your chances of a successful induction, no matter if your plan is to try a natural induction or if you need a medical induction? The answer is yes. In fact, if you follow our channel, then you probably know that the most important thing to make both a spontaneous labor and a successful induction more likely is preparing your body for labor. And this is what we use tools like acupressure or reflexology for, as well as other natural tools.
Yes, these tools are not intended to help induce labor, as many people tell you on the internet, although they can certainly support that process.
Yes, however, their function is actually to prepare the body, in particular the cervix, for labor, and this can help you increase your chances of a successful induction. So if you have any plans to have a spontaneous labor or an induction, no matter if it's a natural or medical induction, then we wholeheartedly recommend watching the video that hopefully pops up now, because in that video we tell you exactly how to prepare your body and cervix for labor. And then if you want to calculate your Bishop score yourself so that you know how likely it is that you will have a spontaneous labor or that an induction is going to work, then please watch the video that pops up now. You can also find the links to both videos on YouTube in the description below this video.
Right. If you have found this video helpful, we would be super grateful if you could leave us a like below this video.
Yes, and for more useful tips and tools on pregnancy-related topics, make sure to subscribe to our channel and to hit the bell.